anytime you're talking about a spectrum, you in many ways are actually talking about kids who can look very, very different. So, for example, on the lowest end, in my mind, let me tell you what I picture clinically. I picture a 2 or 3 year old child who is nonverbal, who is engaging in a significant amount of restricted, repetitive behaviors, who may be lining up all those cars and lining them up and getting upset when you then step in to try and interact with that child. This is a child who does not make good eye contact, okay, who is not socially engaged with other persons. That's the child I picture. So I've talked about the restricted repetitive criteria. I've talked about the social criteria. I've talked about the communication. And one other important distinction in autism we look for is something called joint attention. And what this is the child's sharing and showing of a common interest. So the parent says, "Oh, look, it's raining outside." You know, does the child respond to the parent's enthusiasm and interest in a central joint attentional focus? The opposite of that is trying to engage the child. So, or the child engaging the parent. That's initiating. You know, "Mommy, look, it's a fire truck." That's initiating. So that's really the range on the lower end. And when you don't see those behaviors, we consider that to be very low functioning. The higher end, and a whole nother discussion, is higher functioning autism versus Asperger's. But when I think of high functioning on the spectrum, I also think of the Asperger's child or person. And on that end, what you will find are intact language. These are verbal and sometimes highly verbal individuals. Okay? You may find restricted behaviors. The other two criteria, restrictedness and social, would stand out. So they may talk about not so much lining up their cars now, but on this end of the functioning range, what you're going to find is, say, talking extensively about Star Wars or gorillas or any number of very restricted topics. And in addition to that, you will find some social deficits. So these are persons who have real difficulty processing and understanding social cues. So if I could see you right now, what I would be looking for is eye contact, that you're looking at me, that you're nodding your head for me. Yes, you understood what I said. Any indication that you might be confused, in which case I would be backing up and trying to explain or clarify. And if you really break down all the behaviors that go on in communication, it is incredible to think about how much is processed and needing to be processed at one time. And then knowing how to respond to that. So it's not just understanding those cues, but how do I react to those cues? Those are important features. And so that gives you a feel, I think, for what's on the different ends of the spectrum. And remember, your highest functioning individuals are out there. They hold jobs. They tend to be of average or above average intelligence. So they can be fully functional individuals in the community, but they do struggle with some of the social interactions they encounter in the workplace, at home, in their personal relationships.